Welcome to today's conversation around the Global Health Catalyst. And this specifically is about the Young Catalyst. And with me is Miss Dhalia Bumbaca. Dhalia, welcome to this conversation.
Thank you. I'm glad to be here.
For the purpose of everyone watching us, could you tell us a little bit about yourself, like who you are and what you do?
Yeah, absolutely. So I'm actually a transplant to the United States. I'm originally from Toronto, Canada. But before me, my parents are immigrants from Italy. And so clearly my family doesn't like to stay in one spot. But because of that, coming to the United States, I really viewed myself as a global citizen, which I think is one of the things that drew me to the Young Global Health Catalysts program. But today, the work that I do is largely centered around food. And so about 3 years ago, I launched my own nonprofit organization called WellFed Community, which was really a social enterprise that I co-founded with a couple other women, geared around um, looking at how we do food insecurity work from a new perspective, which we call food sovereignty, which is kind of an emerging school of thought in the food security space. And so today, a lot of my work centers around food education, sustainable practices. We do a lot of food banking and ways that we can kind of build community and active citizenship around food and our access to food. So that's the work that I do today.
Well, thank you for that background and introduction to what you're doing. But let's first backtrack a little bit to the GHC, to the Global Health Catalyst. Like, how exactly did you get involved, and why did you feel the need to be involved?
Yeah, that's actually a really great question because it is actually my origin story of the work that I do today. I was at the University of South Florida's Honors College and got engaged with the GHC program through an honors class that I was taking. And when I was taking the course, it was, to be honest, I registered late, didn't have, like, it was the only one available, and that's why I was in that course. But through that course, we began working on a project on epilepsy in Cameroon. And we wrote this wonderful storybook geared towards kids to kind of demystify some of the preconceived notions of epilepsy. Um, Completing that project, I had thought I'd gotten my taste for what it meant to be in the kind of public health space. But that, I was on a business route and that was the route that I was going to stay on. Because of people like Dr. Asana and Dr. Davidson, my honors college professor, who really pushed me to understand what public health was, I attended the Harvard conference, the Global Health Catalyst conference, to present on the storybook that we'd created and fell in love with the field of public health. Like, after being there and seeing all those people in that room, passionate about um, medicine, but and I mean, some people were passionate about medicine in the traditional way, but most people, they were passionate about medicine in a way of community organizing and dissemination, and that really spoke to kind of my goals and values as an individual of really being engaged in my community. And so from that point onward, my kind of perspective shifted, and I started seeking out more and more opportunities in public health and realized that, well, I had this degree in business, and then I was already in the midst of pursuing my master's in finance by the time I really was engaged. That public health was the space that I wanted to be working in. And so even upon graduating from the university and concluding that coursework, I stayed with the Global Health Catalyst program to see that book through publication. And that was really formative for me because a university might have these really great opportunities to work on projects like this, but it's through engagement in programs like the GHC that you recognize like staying power, like seeing a project to fruition and not just based on, oh, well, that was a spring semester project and now I'm done. And so, yeah, it gave me an understanding of public health. And I took that and now work in the space that I find most relevant to my skill set, which is food, based on my own family story and whatnot, but it's still public health, right?
It's great to just hear how this whole program like entrusted you with the some of the skills that really and equipped you with skills to pursue your dreams in public health of sorts in
Mm.
different ways. But what are some of the key lessons from your participation in the GHC that you could, or key takeaways from this program that stood out for you really?
I think that, well, okay, so the first thing that comes to mind really is an experience I had at that first conference. And so one of the most beautiful presentations I saw, or what to me, was hearing, I think it was a bunch of it was a panel of doctors, and their call, and a lot of the conference focused on like the acceptance of Western medicines. And so, like, you know, with the epilepsy project, that it's not demystifying that it was like a curse, or, you know, that you got it from certain ways that weren't true, versus like, this is how you actually get it. Oh, and by the way, it's treatable with this medicine.
Yeah.
And so a lot of the conference focused on promoting Western medicine in that way. As a solution to a lot of the epidemics that were going on in Africa. But this one panel was a bunch of doctors, from what I remember, and they were actually talking about the importance that while we embrace these Western medicines, we need to remain true to like valuable traditional knowledge, right? And so that balance of, you know, where can food or herbal remedies or just traditional practices still play a role in medicine in Africa, and to remember that we don't have to replace everything, right? It's about blending these spaces.
Right.
And that really spoke to me. I thought that was a beautiful presentation. And as someone who had I was very sick as a child, and they weren't able to diagnose what I had, and went through a lot of Western medicine treatments, and that they weren't successful for me, and actually put me in a worse state of health. And then had traditional natural remedies, went to a naturopath, got those traditional natural remedies, immediately identified my condition, not then immediately started rebuilding my health, confirmed it with more like traditional or I guess Western, I don't know the right terms for these, but Western medicine diagnosis, you know, and was able to move forward and find like health and in my life, because of the blend of those two spaces. It really spoke to me. And so it made me realize that I had my own story in this space as well. And so that, I think, was one of the biggest lessons I learned, was that public health meant the bridging of these two spaces. And that was something I related to. And then the second thing was that nonprofit spaces can be slower than you hope for sometimes. Again, I came from business, right? I grew up in Toronto, very like fast-paced city, and slowing down has always been a challenge for me. And the GHD program showed me that I needed to do that in order to get quality work, be able to collaborate with people internationally, be able to get different perspectives in on the same project. And I might be able to get it to a good product on my own fast, but I can get it to a better product together and over a little bit longer period of time.
Well, there are two things from at least what you've said so far that have struck out for me as you know, your experience as a GHC Young Global Health Catalyst. One was that, you know, you participated with a different mindset, and then it changed your mindset and your perspective about health, and it actually led you into what you're doing today. The second one is that during what I've heard is that during this conference, you found that your story resonated in that space because it blended different worlds that really were applicable to your real life story. So, you know, taking those two examples, what word of advice would you have for a young person out there who is perhaps considering joining the Young Catalyst? And, you know, yeah, what advice would you give them as they pursue this project?
The biggest thing is that everything in life, this applies to the GHC program, your university degree, your professional space, it is what you make it, right? And so you can be engaged. You're only going to, I believe that relationships really are reciprocal. And I think a lot of times when people are in the nonprofit space, they think that they're just giving, but really you're receiving too. And that's what makes a relationship strong. And so you're only going to get out of things what you put into them. And so you need to take responsibility for that engagement. Sorry. Oh. So that's my number one thing, is like, make it what you want it to be, and then you're going to really reap the rewards of it, and then also really develop yourself in that way. And then the second thing is the importance of those experiences is something that I don't think we can get from any other space. You might want to be, you know, an epidemiologist, or I don't know, you might want to go into just be a doctor or whatever it is. But if you don't get this real world experience first through programs like this, you're less effective in your role, right? And so I might be young for the space that I'm in right now, but I've been actively pursuing volunteer opportunities and professional development opportunities and organizations like this since, I mean, my mom made me do it when I was a kid, right? I started volunteering before I could probably walk and talk. But those experiences give you, like, people are always worried, oh, I don't have the 3 years of experience that this job requests, or, I don't have the 5 years of experience that this job requests. But maybe you do if you start with opportunities like this earlier on. And the Young Global Catalyst program really does reach people all the way from high school through young professionals. So just get involved with them as early as you can, because you have so much time when you're young to do these things, and it gets harder and harder to be engaged in this way as you get older.
Well, that's fantastic pieces of advice. Is there anything that we haven't talked about that you would like to tell our viewers about your experience, and or how it shaped what you're doing today, or really anything about the GHC?
One thing comes to mind, and that's that although it's this idea of global in front of the Health Catalysts program, and I think for someone like myself who grew up very global and we really wanted to go down a truly global path in my future, right? Like do aid in other countries and utilize my knowledge of other languages, and uh sticking in Tampa, Florida almost made me feel like I had lost that, right? That I wasn't doing global health anymore. I was just doing health, like community health, and that was not, like, I hadn't achieved the thing I've set out for. But I realized that that might not actually be true. And so sometimes working locally is the first step in a global initiative, right? Or your step in a global initiative. And so I've come to accept the fact that, I am still doing global health because I'm doing local health. I'm communicating with a national and international audience. And those best practices are something we can all apply. And then those skills that I'm developing one day can still be transferred, maybe, or act as a basis to do global work. But it's not to get in this mindset that if you're not doing something in another country, it's not global. And sometimes it might be better to learn it here first, because if you can't do it at home, like, why try to even do it anywhere else, right?
That's fantastic. And then one question that, as a person who is into communication, healthcare communication, like what I'm doing right now, what is the best way? I'm interested in, getting your perspectives on the best and most effective way of reaching the young people and to get them involved.
So I find that, of course, this is an obvious answer, but social media, right? They're on social media, and that's a good way to get involved. But it's also, I think, more importantly than that, is being present in the spaces that young people are present in. So I think we focus a lot on social media and digital connection, but something that's effective in our programs is we're mobile in everything we do. We have an office, obviously, but we're never really asking people to come to us for programming. We're going to them for programming. And so by being present in the spaces that they're in, you see them, right? They see you. And then you might use that as a draw to say, now, okay, but for this program, I need you to be in my space because I need a commercial kitchen. So I'm going to ask you to now follow me back this way, and we're going to do it over here. But it starts first by being where they are at, and not just, sitting at your table and saying, oh, but of course they want to come to me, right? I have all these resources. I have all these things. I have all this great, like, I'm so well-intentioned, right? They're not going to come to you if they don't see you. And so make sure that you're in your community, or whatever that means, right? So on those like in the digital space, maybe it's on those webinars, right? At those virtual conferences, on the Reddit, what are those called? Forums, or whatever it is, right?
Yeah, thank you. Thank you so much. Thanks for your time and everything that you're doing for the in the healthcare spaces, and for really participating in the GHC before. All your contributions are really valued. So thank you so much.
You're
And
very welcome. Like I said, it gave me a lot back.
yeah, and to our viewers, I hope you have learned a lot about the Young Global Health Catalyst program from Dhalia. Thanks for watching for now. Till next time.